Okay, I'm Don Moss, and I welcome you to the Dean's Seminar in Integrative Medicine. And this is an opportunity to showcase the research of graduates of the Saybrook University, both the College of Integrative Medicine and Health Sciences and the College of Social Sciences. You are in for a treat this evening with two fascinating presentations. We will initially hear Dr. Gabriel Posner speak on observing and documenting a novel somatic education method, the Hanna Somatic method. Gabriel Posner is a registered somatic movement therapist and educator. He's affiliated with Elevated Somatics in Denver, the Association for Hanna Somatic Education, and NeuroGrove Integrated Neurotherapy in Arvada, Colorado. He earned his PhD in mind-body medicine in 2022, and I welcome Gabriel to guide us through his presentation.
Thank you so much, Dean Moss. Thanks for being here, everybody. I've got hopefully an enjoyable presentation, and if I have time, I'll do a little bit of interactive experience with everybody. So, yes, I think you covered all of this. I have an office in Denver where I work with people one-on-one. I also do group classes and workshops. And this past year, I started working as well with another Saybrookian, Ashley Bell. She's a neurotherapist in Arvada. And I have been working with her, working with people with brain injuries, with PTSD and behavioral disorders, using adding movement work to the integrative practices that they have there. And that's been a fantastic experience. I also am the current president of the Association for Hanna Somatic Education. We are a member support organization with also a mind towards bringing Hanna Somatic Education to the public more broadly. And then I also train practitioners with essential somatics. So I want to, at the start, just acknowledge that my study with Saybrook, my dissertation study, was partially funded by the Association for Hanna Somatic Education. And I'm really happy to see that my dissertation committee members are here. So Dr. Vega and Dr. Fortune, great to see you both. And my third committee member, she actually passed away in September of this year, or August of this year. And she was a special person in my life. She was also a special person to the Saybrook community. Before it was called Saybrook, Saybrook was called the Humanistic Psychology Institute. And Eleanor Criswell Hanna was actually the founding director of it. She, after teaching at Saybrook, she also taught for a long time at Sonoma State, where she was finally a professor emeritus, and finished her collegiate career at Meridian University. She taught a lot of things, including psychology, yoga, feedback. And when Thomas Hanna passed in 1990, she took over the training at the Novato Institute for Somatic Research and Training, and she continued to lead those trainings up until her passing this summer. She also developed beyond what Thomas Hanna had developed. She created an equine program and a canine program. Thomas Hanna thought that this work could not be done with animals, and she proved him wrong on both of those fronts with horses and dogs. And probably, I think she wanted to work with elephants too, but did not get a chance to. So we'll see where her students take this. I consider her a legend, both in the humanistic psychology world and in the somatic fields. She did so much, only some of it that I'm even aware of. So this is dedicated to her memory and her legacy. And it was really wonderful, actually, for when I graduated in 2022. She was also honored for being there for the 50th anniversary of Saybrook. And I got to have this great moment where I realized that not only was she there to witness the end of, or the fulfilling of one of my dreams, but I could really sense that I was there as the fulfillment of one of her dreams, to have this work be brought into Saybrook in my dissertation. So thank you to Eleanor, wherever you are. So I would like to just go through my dissertation study to find the problem that I attempted to solve, or that I think I did solve. I'll go through my literature review, my methodology, and my findings, and then a discussion. So the problem that Hanna Somatics in general attempts to solve is the problem of global musculoskeletal pain. This is a global condition that leads to chronic disability, financial stress, lost productivity, and has high comorbidities with mental health and all sorts of other health issues. It has both medical costs, the direct medical costs, and the economic costs of lost productivity and lost wages. And so far, treatment methods for this, offering significant and lasting benefit, have been elusive. Primary benefits, the primary treatments for this are either biomedical or biopsychosocial. Biomedical treatments tend to be sort of reductionist. They treat the symptoms, they treat the pain, or they treat what can be observed in diagnostic tools and x-rays or MRIs. So they treat some underlying conditions that can be observed that way with orthopedic interventions or with pharmaceutical meds. More recently, there's been a push towards biopsychosocial treatments, which are more non-dualistic, more holistic, and for musculoskeletal pain are considered now the gold standard, combining pharmaceutical interventions, orthopedic treatments when necessary, as well as movement treatments, group therapy, psychological counseling to address all aspects of someone's pain condition. The approach that I come from is a field called somatics, which was defined by Thomas Hanna in the 70s. He wrote this in 1986, but he defined this in many different ways. It's essentially the study of the first person experience of being in a body, essentially. So from the outside, you can see a person, you might see them as a body, but we don't experience ourselves the same way that we are observed. And so that direct first person experience of being in a physical realm, being in this shared collective environment is what we think of as a soma. And the study of somatics is the study of a soma. Soma refers to these functions, the functions and processes that make up the body of life. And any type of somatic education is designed to enhance and improve those somatic processes. Martha Eddy wrote a great book about all the varied kinds of somatic practices that they are. You might be familiar with some of them. Specifically, I know somatic psychology has been advancing a lot in the last few decades with Peter Levine's work, with EMDR. A lot of trauma work is being done from somatic psychology fields. So that is really, I'd say, in the forefront of public awareness of somatic. But there are also expressive somatic practices connected to the dance field. And there are somatic bodywork practices connected to the work I do, as well as Ida Rolf. Rolfing is a somatic practice, and all sorts of things. And Eddie's book is a fantastic one if you're interested in understanding the breadth of the somatic field. Somatic practices, I would say in general, are very aligned with holistic fields such as Eastern medicine, with understanding that all the different parts that we perceive as different parts are really integrated. Mind, body, spirit are one in the somatic understanding. I would say it's also aligned with the biopsychosocial approach and could be ideal components of multimodal treatment plans. I would say in my work with Ashley Bell in Neurogrove, I'm finding that adding this to multimodal treatment plans is fantastic for the patients. So Thomas Hanna is the person that named this field. It was a field that was already existing when he decided to name it, but he used the word somatics in the Somatics Magazine journal to bring and to incorporate and to gather all the different mind-body practices that were already occurring in the 70s and 80s. The Novato Institute for Somatic Research and Training is an entity that he and Eleanor Criswell started and that produced the training. And also, I don't know if the Novato to produce it, a little blurry around this, but essentially Thomas Hanna was there. He invited Moshe Feldenkrais to come over from Israel to teach the first US training of the Feldenkrais method, which is a very popular movement-based form of somatic work. And this was actually produced by the Humanistic Psychology Institute. And Thomas produced it and participated in it. So he became a Feldenkrais practitioner. And then he developed his own method that he named Hanna Somatic Education, built largely from the Feldenkrais method, some of the movements, some of the techniques, as well as some concepts from the Alexander technique, which is another popular somatic method, and biofeedback principles. I think Eleanor, coming from the biofeedback world and coming from a humanistic psychology world, had a lot of influence in the development of Hanna Somatic Education. And when Thomas Hanna developed this work, he developed it as a clinical application of these ideas. So he honed in on key somatic functions and dysfunctions, and on this concept of sensory motor amnesia, which is the dual loss of feeling and movement when we get stuck in habitual patterns of behavior. If you are constantly stressed, you may start to develop habituation of the stress response, for example, what he calls the red light posture. And once that pattern is habituated and set in, you no longer experience the fact that you're holding yourself in a stress response, but you will certainly feel the ramifications of it in being stuck in a stress response, being stuck with elevated heart rate, lowered heart rate variability, for example, as well as the tension in the neck and shoulders that is so typical of that stress response. But what people often won't feel is how tight they are in their stomach, for example. They'll feel the parts of them that are still in motion, and they will lose the ability to feel and therefore relax the parts of themselves that are just rigid and bracing in their somatic center. There are a couple of other key developmental reflexes that we developed this work around, but the general idea is that any pattern that you do repeatedly and therefore habitually can start to become amnesic. The clinical protocols that Thomas Hanna developed are designed specifically to address musculoskeletal pain as it arises from the habituation of reflexive patterns, such as the startle reflex, trauma reflex, which creates a whole unilateral cringing and twisting, and the Landau response, which is what gets us to prepare for motion, respond to our call to action, to demands of our time, demands of our attention, very much the driver of the industrialized Western productivity is the Landau response, and we call it the green light reflex. So Thomas Hanna developed very specific clinical protocols to address the patterns of tension that develop around these patterns of response to stress, and also specific clinical techniques that we named means whereby, kinetic mirroring, and pandiculation, a voluntary version of pandiculation, which essentially is the stretch yawn response. Pandiculation is something that we all do innately when we're shifting from a period of rest to a period of activity, or when we're getting sleepy and need to like wake ourselves up a little bit. It helps to keep the brain in an active state, or shift to a more relaxed state when we're preparing to wind down at the end of the day. He also expressed 3 levels of somatic education. The first being the application of clinical techniques to specific patterns of tension and pain. The second being, how do you then change your natural way of standing in the world? How do you then align your proprioception essentially with the changes that are occurring so that you don't automatically go back to the way that you are used to doing things? And the third being, when people fail to continue progressing and they keep on going back to the exact same pattern, the exact same pain and behavior, looking at, we refer to as extrasomatic causes of dysfunction. right? What is the environment that you live in, that you work in, that you're going home to? And how might that environment keep you from progressing, keep you from maintaining the benefits that you're getting from the work? So there are numerous theoretical articles and books that Thomas Hanna created. There are many audio recordings. He died at the end of the first summer of what was intended to be a 3-year training program. So he actually only trained 30 people in this method and only trained them a section of what he planned to train. The training was then taken over by Eleanor Criswell Hanna and Associates, and was continued up until this past summer when she passed. Now the original trainees and a few new people are continuing on with the training. Since I published my studies, actually now there's a new peer-reviewed study that was done by one of my colleagues in Saudi Arabia, and they were working with Johns Hopkins. They were working with medical professionals, and they did a repeated measures study asking people how they felt at the beginning and at the end of a few Hanna Somatic sessions for pain. And they found some pretty remarkable results. Essentially, people that were in significant pain were on a 0 to 10 scale, went from about a 5 to an average of 0.8 at the end of 2 to 3 sessions. So in the very little data that we have, it looks very promising that this work could have a really profound effect if we could replicate those numbers in a more controlled, rigorous study. I also found a gap that it's unclear exactly how Hanna Somatic is practiced today, because so much of it is based on what Thomas talked about in the 1990s. So this was the goal of my study. How is Hanna Somatic Education currently practiced? And how does HSC practice reflect how Hanna talked about this work? I chose a descriptive qualitative case study methodology because this is best for work for studying in a naturalistic setting. I wanted to observe this work in the setting that it is typically done. And I wanted to triangulate multiple data points. I also chose multiple cases so that I could have even more data points. And so I could link and discover patterns of practice. So what I did was recruited 4 practitioner client dyads. These are all practitioners who had trained at the Novato Institute under the tutelage of Eleanor and the rest of the teaching team, but all from different time frames. So, and they're also in different zones in North America. I separately questioned the participants and the practitioners. I obtained practice communication, so any emails that were sent between the practitioner and their client. And then I observed and recorded 3 sessions per dyad. I chose 3 sessions because Thomas Hanna would frequently say that 3 sessions is often enough for people to have a dramatic change in their situation. So I wanted to see, okay, if that was what Thomas Hanna said, then we would at least need to do 3 sessions. And then I interviewed, after every session, interviewed separately the practitioner and the client. And then I did a qualitative analysis for emergent themes. The data analysis involved turning all of the data into text form. So I first had to essentially transcribe all of the communication that was happening. And then I made a coding format or coding plan to describe the position. So this work is done on a massage table, typically. It's hands-on work. The practitioner is moving their client through space, is guiding them through movements. And so I described in coded form where the practitioner was standing, what they were doing with their hands, what they were asking their client to do. And then I did many rounds of empirical coding and then descriptive coding. And then I immersed myself in the Hanna Somatic principles. So I really tried to kind of memorize and think deeply about what the principles were so that I could go back through and see where and how each action that occurred during the sessions aligned with Hanna Somatic principles. These are principles I took directly from the training manuals where People are agreeing to practice with these specific principles in mind. And from that, I developed specific practice patterns that were observed in the sessions. I assessed those practice patterns for commonalities and uniquenesses. And then I went back and I observed or considered how those practice patterns aligned with the Hanna Somatic Education literature. The 4 dyad, let me speak briefly about that. So Fern was the practitioner, Campbell was the client. They were in Canada, in a very small rural Canadian town. Fern is in her 80s, has been practicing since the 2000s, as well as practicing Reiki and all sorts of different things. And her client was in her 60s. NB and Sophie, they were from a large Canadian city. NB is in her 60s. The client was in her 20s, is the youngest client. And NB was certified in the 2010s. So she was the most recently certified practitioner. So about 20 years between NB's certification and Fern's certification. Felix is in the US. Also, Jeff is in the US. Felix is in his 60s. Jeff is in his 40s. Their clients were in their 60s and 50s, respectively. All the clients were female. And they all had various musculoskeletal issues. Campbell was having some shoulder pain. Sophie had a knee dislocation. Elise had vertigo and scoliosis. And Samantha had this really nagging back pain that was making it really hard. She was an actress and it was making it really hard for her to continue working. So first of all, I want to talk about the practice patterns. And I mentioned first of all that the level 1, these are the application of clinical techniques. So organizing the session around the clinical protocols and techniques, I found that all of them did this to at least some extent, with the exception that MB only used a protocol for 1 session. Sessions 2 or 3, she still used the clinical techniques, but she organized the sessions more around lessons from the somatics book. Thomas Hanna wrote a book in 1988 called Somatics. In the back of it, he has guided lessons for how to get yourself out of back pain, hip pain, etc. And so essentially, NB constructed the remaining 2 sessions around those lessons in the book. Level 2, again, involves aligning someone's self-image with the new proprioceptive awareness. The main techniques that we do are designed to reduce resting tone so that someone, when they relax, when they come to rest, they're actually more relaxed. So every single muscle in your body, I should say, when you come to a place of rest is still maintaining a certain level of tension. And our belief as somatic practitioners is that that resting tension can be quite high, even though it feels like you're at rest. Your shoulders, you may relax your shoulders and they stay up by your ears, for example. And you think they're as relaxed as they could be because they are as relaxed as you currently can make them. Our techniques are designed to actually change that resting tone. So when you come to rest, you're actually more at rest. But then level 2 involves now becoming aware of the change that occurs so that you can maintain that change. Jeff and MB utilize photographs and video to help align that. Felix used more conventional or more traditional methods to do that, which is essentially having a person look in a mirror and having them sense their way into the changes that have occurred versus simply getting up off the table and walking out the door. So taking a little bit of extra time to align what they can see visually is what they can sense internally to maintain that change. Practice 3, I did not notice really anybody addressing practice 3, which is considering the extrasomatic causes of SMA. When I analyzed it for qualitative analysis, I found 4 key themes. The first is that Hanna Somatic is a mindful movement practice. Mindful awareness is used as a portal to create the sensory motor changes, reversing sensory motor amnesia effectively. Hanna Somatic Education empowers clients towards autonomous improvement, and the practitioners all adapted the protocols to meet their clients' needs. So I'll go into each of these in depth a bit. First of all, I would say the movement first modality, meaning we are using movement to draw attention, to move awareness, to locate awareness. The awareness is situated in the movements, and therefore is a great way for people that can't feel, right? If you tell someone to simply sit and feel, often they'll say, I don't know what I'm feeling. I don't know if I can feel that. I don't know if that's what I think I'm feeling. So we use movement specifically to awaken novel sensation. And this was conveyed with the way that they described the movement, the way that they guided the movement. I have some quotes here, one from Felix, who said, you're going to do these movements slowly and with as much mindfulness as you can. Or as Fern said, if I ask you to do something that's painful, don't do that. This is not pushing through pain. So all of the practitioners emphasized move gently, move slowly, move in comfort, and then pay attention to what you are doing. Mindful attention is what starts it. Movement is what starts it. And then, as Fern says, we're building the connection between the brain and the muscle. We're reintroducing that brilliant highway that goes between the two. So using movement, using awareness to then reestablish connection between mind and body. And these movements used mindfully were done to first identify where the SMA is. SMA is identified, if you were to take your hand, let's say, and just pass it in front of you, if you do it mindlessly, if you kind of swing your arm in front of you, it'll feel very smooth because you're using subcortical, subconscious functions of your nervous system to do this. Your cerebellum does a great job of smoothing movements out. But if you go really slowly, you will find that a movement such as this, passing your hand in front of you, is actually kind of wobbly and kind of choppy. And so that's one way of identifying SMA, that jumpiness, that choppiness. You can sense where you have control of the movement and where your brain and nervous system just kind of pass from one place to the next. So once we have identified SMA, once we have reestablished mind-body connection, we then do that to restore comfortable and functional resting tone. Jeff just was describing this thusly. Now, when your arm touches, you're not completely done. As we get towards the end, my pressure will get less, your pressure will get less, and then we'll finish. The idea of coming to a place of rest and then coming to a place of deeper rest. I need to move more quickly, I see, because I only got 2 minutes left. So theme 3 is all about education. The whole idea being, this is not therapy. We are not doing to the client. We are not trying to fix the client, but it is therapeutic, right? But it's therapeutic through an educational intervention. They are teaching them what to do. They are instructing them and guiding them what to do. And they are explaining the principles and the philosophy as they go along. Theme 4, these are out of order a little bit, excuse me. Theme 4 is that there's a lot of innovation. So even though I noticed that all practitioners did the work in similar ways, use protocols, use the techniques, there was a lot of variability in then what they did because each soma is different and each person was different from session to session. So both Jeff and Fern discussed the idea of improvisation, of going in with an idea of what you could do, but not with an idea of what you will do, and allowing the session to unfold spontaneously. They did this through open-ended questions. They did a lot of positive coaching, and through creating a strong therapeutic relationship. I think there's a lot of humanistic aspects to this, of creating a therapeutic container for the work to then facilitate the shift between both the practitioner and the client. So how did current practice reflect HSC literature? I won't go through the slide. I'll just go through the next ones. So I would say that 3 of the practitioners demonstrated the protocols and techniques consistently. 1 did it somewhat inconsistently. I would say the level 1 of care was emphasized a lot more than levels 2 or 3. But that in general, after 30 years, the work aligned pretty well with how Thomas Hanna talked about it. And I would say also that the work was very consistent between the practitioner that was certified in the early 2000s and the practitioner that was certified in 2018. I'm going to skip that and talk about more implications. I also would say that I found that Hanna Somatic Education is really aligned well with integrative medical principles. It's holistic. The clients reported not only musculoskeletal changes, but they reported psychosocial changes. They were less anxious. They were less worried about what people thought about them, for example. They found that their interactions with their friends were changing. So, and a lot of the things that they discussed were not even the client had to draw out the musculoskeletal changes, but the things that were offered by their client were a lot more of these psychosocial changes. I found that it was minimally invasive, especially with the focus on comfort, slowness, gentleness. So I think this work can be done very safely, especially with people that are in chronic pain or even acute pain. And the empowerment aspect is really important. So in 3 sessions, people were being taught what to do on their own with the intention that they could continue practicing. So I say the cost of the invention approach is 0 because once someone learns how to do this, they can continue doing this on their own without the need to continue working with a practitioner. And that is done through relationship building, through creating trust with the practitioner. Let me see what else I want to say. There's a lot that needs to be studied. I'm working to develop some good questionnaires and some other measurement methods for figuring out what effects we're having. I've done a couple of studies since graduating with virtual class series, and I'm struggling to figure out what questionnaires can be used to effectively convey this work, or at least to convey the quantitative changes that are occurring. But certainly the way people describe this work, I think there's a lot of qualitative studies that can be done too. And let's see, what else I want to say? Conclusion, let's go right to that. Conclusions, I would say that I found in this study that there was a lot of consistency, both between how the practitioners did their work, as well as how it connected with how the work is described. I found that building upon other somatic practices, HSE uses principles of biofeedback and our current understanding of neurophysiology to address our concept, sensory-motor amnesia. A lot of further research is needed to clarify exactly what HSE is and its efficacy. I'm interested in working actually with NeuroGrove and to maybe put an application in for some government funding. If anybody is aware of any funding sources for movement-based somatic practices, I encourage you to reach out to me. And I think that if we can demonstrate the efficacy of this work that at a large scale and find numbers similar to what Xiuju Huang and her colleague did in the Saudi Arabia study, this would have huge implications for the treatment of musculoskeletal pain, as well as other chronic somatic conditions. I think a lot of somatic conditions are probably have a physiological basis that is not well understood currently. Since graduating, I've continued to develop investigations into this method. I have also begun looking at how we can use these approaches, these techniques and philosophies for other integrative techniques, such as working with massage therapists. So I have a workshop for massage therapists and also a book on that topic that will be coming out through Handspring Publishing in 2025. And then most recently, I've developed a course with a somatic meditation, not medication, meditation teacher, combining Tibetan Buddhist practices with somatic movement and having really fun time with that, especially for people that have a hard time meditating, a hard time sitting still due to PTSD or other psychological or trauma, other challenges. People are really enjoying the calming of their nervous system, as well as the way that we can use movement to wake up awareness, so that then when they attempt to meditate, there's more available for them to connect with. And I'm working on continuing to develop assessment tools for this. So thank you so much. My email, if you want to stay in touch, is gabriel@elevatedsomatics.com.